Big changes are out for those who contract COVID. The CDC has cut quarantine times in half for many of those who contract the disease.
Our business and policy reporter Justin Backover is in the studio with more on that. Justin.
Yeah, Wendy and Rob, these new shorter guidelines are supposed to make things easier for workers and businesses that have to quarantine, but some health officials are questioning the timing, and there are things you need to look out for to make sure you're making the right decisions. The CDC has cut the recommended quarantine period to 5 days from 10 for asymptomatic COVID cases, followed by 5 days masked around others.
What this is really is an accommodation and a generalization that is partially based on science and then obviously is also based on some of the political and business realities of having a workforce shortage.
The CDC also says those with symptoms who are getting better may leave their homes after 5 days so long as they're improving. However, Dr. Jahre with St. Luke's says employers must look at each situation individually.
One of the things that can happen is they can have a relapse and you'll have a short-term gain and a long-term loss.
Also, if you've been vaccinated and exposed, that quarantine has also been shortened to 5 days, according to the CDC. You may not need to quarantine at all if you're boosted. The Lehigh Valley Chamber of Commerce says with rising cases, the flexibility is needed.
We're learning to deal with it better. It's not going away, and we need to do whatever it takes to address the workforce shortage crisis, and we have to do it safely.
While these are just recommendations of the CDC, they're tied to other things, specifically OSHA requirements that say you have to provide a healthy and safe workplace for your employees.
This is just a new minimum. Businesses can keep the 10-day quarantine if they want, says Allentown labor attorney Ed Easterly.
This has now lowered the threshold for what employers are required to do so they can bring their employees back in a more rapid manner.
Again, these quarantines should really be determined on a case-by-case basis. At-home testing is a great tool to see if someone is transmissible or not before they return to work, if you can actually find a test. And if you do return, make sure you're wearing an N95 or KN95 mask. Back over to you.